Senator Cassidy.
Thank you, Mr. Chairman. The COVID-19 pandemic has strained our healthcare system. It's placed a huge burden on healthcare workers. So as we come out of the pandemic, this hearing is to address workforce issues. Why are there still shortages post-pandemic? Which are most pressing? And how do we get the understanding to address it? There's an old saying in internal medicine, don't just do something, think. We must first think about what we should do. Now, physicians in hospitals in Louisiana tell me they need nurses. And speaking as a physician who had the great fortune to work with many incredibly talented nurses, they are essential, goes without saying. There's different things we can do. I'm going to use an example of a woman I once worked with to explain the concept of upskilling. Linda started off in the clinic as a medical assistant. She kept going to school and got her LPN, kept going to school and got her BSN, kept going to school and got her master's, and at the end was the nurse manager in the clinic in which she had begun as a medical assistant. That is upskilling. And along the way, she improves her family, helps patients, but demonstrates for her children the power of education and the power of delayed gratification. There is a lot in that story that can inform what we should be doing on national policy. And Linda, you know who you are, wherever you are, I'm talking about you. Now, something that is, by the way, this is not all federal. We know that there is a shortage of nurse educators. But when you look at the requirements, in some states, mine included, you have to have a master's of nursing to be a nurse educator. Now, I have worked with certificate nurses who have been by the bedside for 20 years who knew nursing. The idea that we cannot use someone such as she in order to educate others, I think, doesn't acknowledge how much she knows. And this is a way to remove a choke point which is preventing all these applicants from having more slots in which to go to fill our nursing shortage. Now, I agree with the chair. We can and should work in a bipartisan way to address nursing shortage and other shortages aside from nursing. And my hope for this hearing is to identify those other providers and those areas, as the chair mentioned, such as rural areas that have critical workforce needs. But why don't we use the workforce we have more efficiently? I say that because there was a recent study just before the pandemic in the Annals of Internal Medicine that found that physicians spend as much as 16 minutes per patient filling out the electronic health record. Now, speaking to my colleagues, many of them retire early because they're sick of that. It is a major cause of burnout. So that which has been implemented by the urging of the federal government is creating the problem of physician workforce shortage. For the patient, it is a difference between having a physician type on a screen as he tells you that you have cancer or looking into your eyes and telling you that you have hope. We need to give that physician the ability to communicate hope. This is something this committee can look into, understand, and address. On a larger scale, the federal government invests billions towards healthcare workforce programs. We need to continue to support what's working, understand what is not, and fix that which is broken. We have to be good stewards of the taxpayers' dollars, not wasting money. We have to be productive. This year, the committee is tasked with extending mandatory funding for programs like the National Health Service Corps, which offers loan repayment and scholarships to healthcare providers in exchange for working in a health professional shortage area, and the Teaching Health Center's Graduate Medical Education Program, which supports the cost of training medical and dental residents in outpatient settings. Additionally, we are tasked with reauthorizing the Children's Hospital Graduate Medical Education Program set to expire this year. This program, this legislation supports training of pediatrician and pediatric subspecialists, noting that nearly half of all pediatric residents train at a children's hospital. It's important that the funding for these programs is extended on time in a bipartisan fashion and that it be paid for. Finally, I know today's witnesses have innovative ideas on how hospitals and academic institutions can support the pipeline of health professionals. One of my witnesses will speak directly to that. The federal government does not play the only role in seeking a solution to workforce shortage. We need to hear the perspective of these experts as we bolster America's healthcare workforce moving forward, and while doing so, just like Linda, create more opportunity for the individual. Thank you.
Thank you, Senator Cassidy. We have